Sinusitis. When do you actually need antibiotics? Sinusitis is a common condition that affects millions of people each year. It occurs when the sinuses, the air-filled spaces around your nose and eyes, become inflamed. This inflammation can cause symptoms like nasal congestion, facial pain or pressure, headache, and sometimes fever. One of the most frequent questions patients ask is, when do you actually need antibiotics for sinusitis? Sinusitis can be caused by viruses, bacteria, or even allergies. The vast majority of sinus infections are viral, meaning they do not require antibiotics. Viral sinusitis usually improves on its own within 7 to 10 days. Antibiotics, which target bacterial infections, are only necessary if there is clear evidence of a bacterial cause. Medical guidelines suggest considering antibiotics when symptoms last longer than 10 days without improvement, or if symptoms worsen after an initial improvement, sometimes called a double worsening pattern. Additionally, severe symptoms such as a high fever over 39 degrees Celsius, 102 degrees Fahrenheit, significant facial swelling, or intense pain may also prompt healthcare providers to prescribe antibiotics. It is important to remember that routine use of antibiotics in most sinus infections offers little benefit and can contribute to antibiotic resistance. A common misconception is that any nasal congestion or sinus pressure means antibiotics should be used, but this is not true. Most sinus symptoms stem from viral infections or inflammation and resolve with simple supportive measures. These include staying well hydrated, using saline nasal sprays or rinses, applying warm compresses to relieve facial pain, and resting adequately. If symptoms worsen or persist beyond 10 days, or if you experience severe signs, it is advisable to seek medical evaluation. A healthcare provider can determine whether antibiotics are appropriate based on your specific clinical situation. In summary, antibiotics are not routinely needed for sinusitis and should be reserved for cases likely caused by bacteria or with severe symptoms. Understanding when antibiotics are necessary helps avoid unnecessary medication use and supports better overall health. Thank you for watching this edition of ENT Explained, your trusted source for clear, evidence-based ENT information.